Okay, I think we can start it now. Hello, everybody. Thank you for joining us for the 24 sessions of OMNI-RÉUNIS Super Spreader Seminars. And I appreciate your joining. Let me share my screen to have the introduction for our speakers we have today. Okay. As of on 11th of July, we have the OMNI-RÉUNIS Super Spreader Seminars, the 24th sessions. And initially, we have the land acknowledgement. We acknowledge the land the OMNI-RÉUNIS Network's head office is located on York University, recognize that many indigenous nations have long-standing relationship with the territories upon which York University campuses are located, that precede the establishment of York University. York University acknowledged its presence on the traditional territory of many indigenous nations. The area known as Tikuranto has been caretaken by Anishmek nations, Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nations, Inuit, and Métis communities. We acknowledge the current territory holders, the Mississaugas of Credit First Nation. This territory is subject of the Dish with One Spoon Wampum Bill Convent, an agreement to peacefully share and care of Great Lake regions. And about the Super Spreader Seminars, the OMNI-RÉUNIS Super Spreader Seminar Series stands for SSS, welcomes faculty members, OMNI-RÉUNIS affiliates, and highly qualified personnel, including postdoctoral researchers and graduate students, to showcase their research, promote their ideas, share their research experience, and establish connection among the various branches of the network. It is a platform to spread scientific knowledge about the One Health research framework and the research progress of the above 30 OMNI-RÉUNIS HQPs within the network scientific research community. These seminars facilitate knowledge exchange with OMNI-RÉUNIS, the Emergence Infectious Disease Modeling, stands as EIDM networks, and the collaborating scientific community. Today we have Somto and Mbelu. Thank you, Somto, for joining us, and thank you for accepting our invitation. As you can see, Somto Mbelu is currently a final PhD candidate at Ramses University Rotterdam, the Netherlands, with research focus on ethical consideration for artificial intelligence-enabled healthcare platform in Nigeria. Somto is the Nigerian coordinator for the West African Network of Emerging Leaders. He also served as the program coordinator for USAID Integrated Health Program, a private sector-led stream of work by Farm Access Foundation in international NGO dedicated to facilitating affordable access to quality healthcare in Africa by simulating investment in healthcare industry through partnership with the private sector and government institutions. In 2017, while working with the App Association Development Foundation, led USAID Health Finance and Government Project in Nigeria. As the knowledge management and communication specialist, he supports the healthcare transformation efforts of the Nigerian government through the deployment of strategic contextual communication tools for improved health financing reform through domestic resource mobilization and drafting and implementing health insurance policies and supporting healthcare financing, especially for tuberculosis, HIV, AIDS program in 20 states of the country. Oh, that is great. Somto also steered the development of digital communication strategies for universal health coverage in Nigeria through the Joint Learning Network for Universal Health Coverage in partnership with Nigeria Federal Ministry of the Health. I really appreciate that we have Somto here. As you can see, this speaker's bio and information are given in our posters too. And I will skip the rest of the parts he has done, and we will focus on his own talk to share his talk about advanced design justice, ethical consideration in the development of AI embedded health insurance platform in Nigeria. The work he has done with Christopher Bonner and Hope Zwartz. And their study outlines the concern of marginalized population regarding AI-driven healthcare and their perception of healthcare insurance initiative in Nigeria. It emphasized the concept of healthcare access, focusing on the patient-centered perspective in chronic care. While AI offers potential benefits in improving diagnostic accuracy and operational efficiency, its integration raised ethical consideration, including bias in algorithm and data privacy. The abstract he's going to share in his research examines the challenges faced by end users of health insurance, such as financial contribution and satisfaction with services. Thank you all for joining this series. I will stop sharing, and I really want to say welcome to all of you, and mostly our speakers, Somto. Somto, can you share your slides and let's have your talk? Thank you.
Right, thank you so much, Sanzi, for that very lovely introduction. So I'll share my screen now.
Great, thank you. Yeah, full screen, great. Thank you. Let's have you.
Okay. Thank you all for the opportunity to present my research work with you all. This is a research work of 4 years. Started in 2019, and then rounding up in a few months' time. So when the final stages of the work, well, it's almost work completed in progress. So and after the presentation, I'll be happy to get your thoughts, questions. So in this research, of course, the overview will have a background. I'll talk about research objectives, have some backgrounds on the ethical theory, which will guide us through this conversation. And we're looking at the issues around, the work, this research gap, talk about methodology, results, of course, the conclusions, and then key recommendations that we're looking at, and of course, future directions of this work. This write-up, gives an overview of background of Nigerian healthcare system, or Africa healthcare system in Africa, which of course has very inadequate financial risk protection for health consumers, which of course requires a lot of people to pay out of pocket. And now Africa, it has had the highest points of its lowest universal health coverage, meaning that most people have to, access healthcare out of their pockets, and of course, leading them to poverty, because we can imagine people that are struggling to, feed, or and then they fall sick. Imagine the money you've saved over the months, and of course, you're using that to get healthcare. So you could imagine how that can be, to the layman. And of course, over the years, health insurance, is characterized to see that health insurance can be a vehicle to advance the tenets of universal health coverage. In essence, to say it can advance stopping, let's say, mitigating the effects of out-of-pocket expenditure. And of course, we know in advanced nations, also in Nigeria here, health insurance is being propagated by, the government, people that work for companies that have private insurance for the organization. But the question is, what about the underserved and people who are living in abject poverty, or people who do not have access to the blue-collar jobs that have standardized health insurance cover? So private organizations in Nigeria are really looking at how do we get how are we going to be creative to see how we can ensure that people have access to healthcare. And they're really looking at, maybe we can look at deploying AI or digital health platforms. And if you also see in Africa, especially in Nigeria, We could see how mobile technology has advanced financial services to the underserved, especially to the nook and crannies of the country where people have access to POS, have access to apps and do transfers and all that. In Kenya, they have the M-Pesa, and all that. And people are saying if this can be done in the financial services, welcome how we can see how we can deploy AI and digital health platforms, to the underserved, to see how we can help them, access healthcare. Well, this is just an overview to say that already in Nigeria, there is high penetration of digital health platforms and startups. And this is, and if you see the information here, this is as far back as 2019, 2018, 2021, to say that already Nigeria is already in the forefront of developing mobile technology, AI-enabled health platforms to see how they can advance access to quality and affordable healthcare. So the penetration of this is something that is laudable. But the question, take us to the question is, will this hold to the promise of advancing affordable and quality healthcare to the underserved, or to enable them access healthcare? Just like the example I gave earlier in how financial services have been, enabling access to financial services at the remotest part of the country and even to the underserved. So that takes us to the research objective of this work. Will be the study the objective of the study is to investigate the role of AI and mobile technology, how it can play in evaluating risk, enabling access, and thereby reducing cost of health insurance for the underserved, while advancing the tenets of universal health coverage in Nigeria. To advance the most stable ethical principle that will guide the building of such system in alignment with the cultural context in Nigeria, while ensuring data trust, privacy, equality that are deployed in designing the AI-enabled health insurance platforms in Nigeria. So, we're looking at two things in this work. How do we ensure that the role of AI and mobile technology could play? And I tell people that a lot of conferences on advancing, improving access to healthcare that I've attended, out of in Europe and also some parts in America, everybody is saying one thing, that Nigeria is a country of 200 million people, and there's a huge penetration of mobile technology, and that means that means if they have mobile phones, that means we can see how we can get them to access healthcare in their hands. But the fact is that actually true? If they have mobile phone, does that mean that can actually enable access to healthcare services? And then I think we will have those questions answered as we proceed. So in this work, we'll be looking at some, ethical theories that will also underpin and guide this work, which is, of course, tailored into three: the consequential and the non-consequential and the alternative. And we could also see issues around egoism, utilitarianism, Kant's virtue theory, and ethics of care. But if you could see the arrows in all these theories, the most important one that really connects to healthcare, which says what will bring the overall good to the stakeholders, right? Looking at what will give everybody, the good of everybody, what that will bring all over advantage to everybody, and looking at healthcare, healthcare connects the decision to maximize the well-being of everyone, such as resource allocation, and the goal is to benefit everybody. So in this work, we are going to be working with utilitarianism in terms of, the ethical theories that will be guiding this work. And also looking at the theory here, you can also see that, if I'll take the part of the ethics, the cons, to say the greatest good for the greatest number of people and making decision based on what benefit the majority, and if you also look at the other one, the pathology ethics and the virtue ethics, these are all individualistic, ethics that really, make some more on, self and not more of the public and the general public. And that's why even in healthcare ethics moves in the utilitarian aspect. So in this work, while researching on going through the literature review, there are some things that we'll be able to point it out in terms of the gap, that I've noticed, around, using AI to advance healthcare. And one of them is certification of common good services. And this basically says the process of transforming, services meant for a common benefit, and, making it all about, harvesting and, using of data, basically to optimize those services. And we know what happens when everything is based on data. Most people are not documented. So you can imagine countries or places where you have the undocumented and people who are not really having their numbers, or captured with the state. That means they might be excluded in such services, especially when those platforms are used, to advance things bordering around healthcare. And next one is platformizations of services, and this looks at where issues around the shift from traditional service delivery and moving everything into database, and this all putting everything in one control basis. And I give this as an example as when when someone loses his or her phone, you can't literally do anything because somehow you just discovered that all your whole power or everything has been given to one, because your email address, your whole number, your numbers, your email, your WhatsApp, everything they are no more in your hands. You probably think they're in your hands. Literally, you cannot do anything because all these data and all this information has been centralized. And that is what we also discovered, that when most of these services, when they have been pushed, these are what we're looking at, putting all information, all power, or all strength in the hands of just one organization or one individual. And for example, you can imagine building an Instagram account, and someday the landlord of social media decides to lock you out, and Zach, and you cannot do anything because you don't have access to it. And now most platforms are now connecting to each other. You could see Facebook linking to WhatsApp, linking to buying up Instagram and all those things, meaning that one person has access, can control the access to every information. And next one is surveillance capitalism, issues around economic system, centered on the combination of personal data, right? And you could see where information, details of people are being analyzed, using user data to predict outcome. And we have stories of where in some cases, in the US, where issues around data has been used to determine how much people will pay on insurance, making it more discriminatory because, of course, because of the data that has been generated from those individuals' history. And you could see those individuals paying more on health insurance. And next one is privacy harm, violations, algorithm discrimination, and automating inequality. And we could see that where the algorithm has been, tailored information provided into these algorithms are tailored into such a way that are skewed towards a particular angle. Like I mentioned earlier, you could imagine people who are undocumented immigrants, for example, individuals who maybe because of cultural settings, they decide not to access, be on documented or get themselves into the digital space. You can imagine how those guys or those individuals are being excluded to access healthcare. So these are the gaps, things we discovered on the literature review. Why putting our content together. So the research question we're building on is, how can we build an ethically AI and digital health insurance platform that can advance the well-being of the underserved in Nigeria? So we looked at the methodology we used on this study was a qualitative approach, which was adopted. And in this qualitative approach, we divided our stakeholders into the policy, looking at it from the policy angle, the design angle, and the user angle. And the policy angle, we had a semi-structured interview, in-depth interview, and of course, content analysis, getting content, from different information platforms to, just opposed with the information gotten from the policymakers, that's the regulators, people in government, and CEOs. the goals basically is to assess the drivers behind the infrastructure and the system, that, drive all these and policies that drive all the system. And in terms of the users, we're also looking at, we had focused discussion, group discussions with gig workers and low income earners, and to understand, to understand their role in AI in terms of UAC impact on inequality. Do they have health insurance? How do they access health insurance? Are they head of digital health platforms, AI platforms? If they have they used it before? So sorry, go back. So the next is tech designers, who's taking us through. Just a minute, I need to hide this. So taking us through identifying the values in design, right? Because we need to understand where tech individuals are building platforms. How are those platforms built? Are there values in that design? Are they framework? Are they guidelines that guide those designs? I tell people, sometimes people download apps, a lot of apps in their phone, and sometimes because of the information they give you to tick up, because it's too long, you just approve without even knowing the rules and the regulations or the statement that are put on before you download those apps. People that design healthcare apps in Nigeria, how do they design? Do they design based on a particular guide or form, or do they just deploy to just have their apps in the market, have people to download and make money? So these are how we position this conversation within the policymakers, the users, and the designers. And not only that, we also went online in Nigeria to just oppose different healthcare platforms and finance platforms, tech platforms, to also do some content analysis to be able to, deduct and identify some recurring codes and, information that will really give us more room to just oppose the data collected, samples collected from the users, the designers, and also the policymakers. So from the qualitative data from interview, we used some thematic content analysis, and this method we identify deeper insights and, of course, recurring codes. When we just oppose the information we got, content analysis from the conversations we also had with the three stakeholders I just mentioned earlier, which is healthcare access, patient centers perspective, especially in chronic care, things that teams got most that appeared more was potential benefits in improved diagnostics accuracy and operational efficiency through AI. And then what also pops more, it was issues around ethical consideration, bias in algorithms, data privacy, and then, of course, challenges of financial contribution and satisfaction with services. Because like I mentioned earlier, the users, it was, during our conversation, we also, discovered that most people, they say they had phones, but they don't have internet. Some say they have internet-enabled phones, but they can't afford to buy data. And these are the issues, because when you say that there are strong mobile penetration in Africa, the question in Nigeria, in Africa, basically, how many people actually can access any services through those phones, because issues, also some people, so lack of electricity. So these are issues that if you're deploying any digital platform, these individuals might be excluded because of these issues, on the ground. So these conversations, we're able to, identify, some results, right? And these issues were low awareness among non-internet-oriented demographics, So we could also understand that you have the older generation that are before the millennials, right? Or yeah, it's called millennial. The older generations that do not really, can't even operate the internet, right? If you're making this platform for them, how do you ensure, how those people say, how would they even operate or even access the services? And then issues around cybersecurity, privacy of data, ethical concern among designers, legal frameworks and data infrastructure, and ability of healthcare personnel to even operate those platforms are things that we got, from our results. And then we also had information, concerns about bias, accountability, and transparency was brought around stakeholders, right? in terms of issues around AI algorithms, what are the potential to even, will it, worsen the inequalities that are already happening, or will it erode and erode public confidence in the healthcare institution? Because we also understand that these individuals are not used to this, and most of these are, questions that people are also asking. And then issues around empirical results, the empirical result provided important insight in potential and difficulties related to integration of AI technology with substantial implication for healthcare policy and practice in Nigeria. The question is, from also stakeholders looking at, do we have the right policies in the country to really guide the development of these policies? And also the result also highlight the necessities through regulatory frameworks, right? Countries are up to date. This internet technology spring up every day. How strong is the Nigerian government, able to really follow through in terms of, bringing out laws that will frameworks that will really lie side by side these inventions. The next one is prioritizing problems like data privacy and algorithm transparency and equity in the use of AI is also necessary for policymakers, because they also mentioned it, because issues around transparency, how these things are being deployed, are also questions, that the users are also, asking, and the outputs from those conversations. So in conclusion, digital health insurance holds promise for improving healthcare in Nigeria, but addressing its limitation is crucial for maximizing its benefit. People are excited about digital healthcare, artificial intelligence, but there has to be very, meticulously addressed in terms of how best to maximize the benefit. And the next one is, the study also emphasizes on the need to inclusivity, multi platform and affordable solution to overcome existing barrier and ensure fair access to healthcare. I also mentioned that, most people are undocumented, right? And most people are also, the demography has gotten to a point that they cannot really, don't know how to address, because of educational background or because of age, to also use this platform, So there has to be need in a way to ensure that there are inclusive, systems put in place for this to, to be used in an appropriate manner. Issues around collaborating effort among policymakers, healthcare providers, insurers are very important, right? So the importance of co-creating and not having people designing these platforms in their rooms, in their labs, and deploying. That is also important, having people coming together to co-create these platforms. In that way, every stakeholder is being carried along in terms of their needs and aspiration of, designing the laws that will guide the development of these platforms. Next one is also, by prioritizing this measure, Nigeria needs to move closer to more equitable and efficient healthcare system by bridging the gap and promoting inclusivity for universal health coverage. Because if we're talking about universal health coverage, is access to quality and affordable healthcare for everybody. So if you're bringing AI, it should be something that will promote inclusivity and not, inequality. So there has to be measures put in place so that this will be able to achieve the tenets of universal health coverage. Adopting UHC, the government should also consider advocacy. Like I mentioned earlier, maybe most people are not informed or educated, because of their demography or because of their age. So there has to be a strategy in such a way that the government also have to carry people along in terms of advocacy, in terms of education, to ensure that everybody is carried along, so people might not be marginalized in accessing healthcare via these platforms, And I hear people say, oh, I had a lot of telemedical platforms that say you can be in your village and have access care from a doctor in the US and all that. But the question is, how many people in those villages have the right education, have the right knowledge to be able to access this platform? So that means that there has to be a contextual, a strategic guide in terms of moving up advocacy to ensure that, you know, people are carried along as these designs, these technological ideas, you know, are coming on board. So next one is, of course, issues around privacy and data protection, which is very, very important. You know, most respondents agree that the laws guiding data protection are not inclusive in terms of terms and conditions for software platforms. In Nigeria, we have the Nigerian Data Protection law, you know, which was put in place some years back, which of course is the offshoot of the GDPR, European Data Privacy Law. But the question is, are those laws are so generic? So, for example, they don't really speak specific to the industry, especially to the healthcare system, and also issues around conditions about software development and all that. So there has now to be context and industry-specific generic laws for different sectors. For example, health industry, being a very, very sensitive industry, should also have its own generic, you know, digital or AI regulatory laws, and not it being feeding into the general country laws. You know, by that way, we will have a law that's specific to the industry, that speaks the language of industry, so that it can also, you know, guide the regulations and the ethics of the healthcare sector. The next, government should encourage private institutions to adhere to policy guidelines, promoting interests of users who are considering the possibility of creating sector-specific privacy and data protection laws. So, like I also mentioned earlier, government should encourage institutions, you know, to adhere, you know, so because sometimes when these laws are put in place, companies come in and design and deploy, even harvest data and leave those countries. So there has to be a conscious effort when these laws are put in place to have these people to be able to adhere to these guidelines, you know, in designing and deploying these platforms. So to be the interest of people who use these platforms. So for key recommendations, legislation and regulation, you know, if we are all talking about, you know, artificial intelligence, e-health industry and all that, but if we don't have good legislation and regulation, you know, putting into laws that govern it, we've not yet been successful. So we're advising that, you know, recommending that, you know, the adoption of UAC legislation and establishing a very sustainable e-health industry or AI-enabled health industry to ensure alignment with international standard, you know, and not just aligning with international standard, but also have some strong contextual basis that can also speak for the country itself. Basically, a system that can, you know, adapt anywhere. Funding and investment. You have to amend laws to make healthcare insurance mandatory and extend coverage to the marginalized groups, and encourage private sector investment in the healthcare industry in Nigeria. During my, you know, conversation with some users, some don't even have health insurance, right? So if you don't have health insurance, you know, advancing using AI and digital you've not even gotten to that stage. So, you know, for us to also move this forward, there has to be laws, there has to be a campaign to also ensure that everybody, you know, the groups, marginalized groups, you know, have access to health insurance, and government has to fund, invest, and make this happen. Data privacy and education. Like I mentioned, there has to strengthen data the data protection laws, improve medical education policies, and combat brain drain to enhance the healthcare workforce, right? If we are pushing in for the issues around AI and data privacy, but they have to strengthen the data protection laws. Like I mentioned, there are need for sector-specific laws. You know, the medical industry cannot be aligning itself with sharing, you know, generic data because of how sensitive the industry, the sector is. Of course, we have to start looking at combating brain drain. You know, workers in Nigeria are living, looking out for, you know, places, you know, for greener pastures where they could earn more. So these are things that should be looked into and should be improved. Technology and accessibility. Have to embrace and telemedicine and health platform to improve accessibility. But It has to focus on culturally competent care, invest in reliable infrastructure, including electricity and internet services. Like I mentioned earlier, embracing telemedicine and saying someone in a remote village in Nigeria can speak to a doctor in the US and access care through those platforms. But the question is, do that individual have the right power to power his or her those platforms, or those platforms that will activate for enable him to speak to doctor or to access care to all these platforms? So it is important that government should invest in technology and accessibility. The next one is public awareness and advocacy. Develop tech orientation program, facilitate community engagement, and use evidence-based lobbying, and invest in educational campaign to increase familiarity with e-health services. So like I mentioned, part of the information that was drawn during engaging with the users was that most people are not even in alignment with the same pace with the way tech is moving. And that's caused to the importance of digital rights, education and campaigns, where government can facilitate in community engagement. So when these platforms are being built, these people can be able to access it and enable them to familiarize themselves with any e-health services that support the tenets of universal health coverage that is being provided by the government. And future directions, what are we looking at in this research? Long-term impact assessment. We're focusing on conducting long-term impact assessment for AI integration in Nigeria's system. This involves evaluating the effectiveness and sustainability of AI-driven interventions over a dedicated period, considering the factors such as health outcome, cost effectiveness, and equity. So like I mentioned, this work is all about ethics in healthcare, but there still need to start looking at how do we conduct long impact assessment to even understand the system more in terms of the sustainability of these interventions. So the need and importance of user-centered design. We have to start looking at issues around prioritizing user-centered design approaches to ensure that AI-driven healthcare solutions are tailored towards the need, preferences, and capabilities of end users. And it's been said, right? You don't design platforms just because you want to design platforms. So recently, we could see that how the European Union were able to compel Apple to design their phones to start using Type-C chargers, right? And because of because of some reasons best known to them. But the example of this is that these designers or producers of this digital platform can listen. So we have to start going back to user-centered approaches where the user or our king, they are the ones that will really describe or guide the way those platforms, because at the end of the day, they are the ones who will be using these platforms. And this involved engaging stakeholders in design process, like I mentioned earlier, co-creating, getting the health insurance providers in the room, getting the government people in the room, getting the users in the room, representatives, and getting their feedback in terms of conducting usability testing, iterative refining solution based on their feedback. And at the end of the day, it is a win-win for all. The next one is health equity and access. There's an important need to further investigate on how can AI be leveraged in promoting health equity and improving access to healthcare, particularly marginalized and underserved, right? Research in this area should examine innovative approaches reaching remote, vulnerable community and reducing healthcare disparities and addressing social determinants of health. How do we make this happen? For example, like I mentioned earlier, someone who do not have access to light, right? Who even have access to a mobile phone, or even has a mobile phone without an internet, or even has a mobile phone, but the mobile phone is not tech-enabled. Is a normal mobile. Is the other mobile phone that the smaller share of those mobile phones. So how do we start, advancing health equity and access? So there has to be further investigation in our research and is to be able to promote equity and accessibility. That's capacity building and workforce. So there's need to build a capacity of expertise on AI and digital health among healthcare professionals, policymakers, and other stakeholders. If we're looking at us putting out the right regulation and policies in place, you have to bring your legislators, people that make the laws up to speed and guide them to say, look at the current trends in the industry. And this has to be done through contextual, detailed, meticulously guided capacity building, programs that focus on educational resources, professional development opportunities, and equip individuals them with the skills and knowledge to leverage, not just leveraging AI in healthcare, but also saying to ensure that the right laws that guides the regulation and deployment of AI is being advanced. So the next one is given the complex nature of healthcare challenges and future research should encourage interdisciplinary collaboration, partnership across sectors, discipline, and also stakeholders. So like this research is more of an interdisciplinary kind of work, talking about health insurance, talking about EI, also talking about healthcare, universal healthcare. So there has to be more of this conversation, and partnership across disciplines to also see how innovative ideas, can be developed in order to, advancing the tenets of the universal health coverage. So I think, thank you for the opportunity to share this work with you, and I'm open to your questions, and thank you very much for the invitation. It was nice speaking. Thank you.
Thank you, Somto. We all have enjoyed. And thank you for giving us a big picture of what has happening. And besides going to having somehow detail-oriented look to the details, thank you. It was very interesting and new, at least to me. And is there anyone there? Is there any question in that among the audience? You can put your question in the chat.
No, I just wanted to say something. Thank you so much for gracing us. I appreciate that.
You're welcome. Thank you.
Thank you, Whitney. Joseph raised a hand. Yes, Joseph?
Yeah, thank you, Somto, for the great insight. Yeah, I have a couple of questions that I just would like more clarification on. So my first question, I think at some point I understand that one of the issues, the big issue is, with the AI platform would be, access to data, because people don't have the money. Money is an issue in Africa, and people cannot buy data to go online and then be able to use the platforms. Yeah, so I was thinking, would it be possible to have like an offline platform where people can even access when they don't have data? Yeah, because people call you from Africa and they just couple while they put up their data because they have to save data. So like, is it possible, you guys are in AI, to develop an AI platform where they could probably go online to update, whatever it is, and then they go offline. And if they need help, they can just even access the app offline. Is it possible? Like trying to solve the problem of data issue.
Oh, yeah. Thank you so much for that question. Well, when I was having interview with one of one of the CEOs of a very big AI and tech platform here in Nigeria, the question I asked, when you're building your platforms, do you put in mind people who do not have internet-enabled phones that don't use data? And he said yes, that in fact, when they are building this platform, they have the USSD, options. So if you remember the USSD options where you use your phone and you could send some codes, via your those smaller mobile phones, you'll be able to give it some prompt and it'll be able to do that. So they said that they have options for that, and they put that in mind, that there are some people who might not be able to afford the tech or the strong bigger phones or the more data friendly phones. So they put in mind those, and you can also see there are innovations like that. For example, in Kenya, like I mentioned, the M-Pesa, people using USSD code through the M-Pesa, the mobile money, through accessing care, buying, healthcare, through that system. So yeah, I think examples like these are things we can try to leverage. But like I mentioned, AI can be so exciting, people can get through it, but if we don't pause to think, we might be excluding, some people that we think that because they are also moving on our pace. But it's important we also have those people in mind while designing platforms that are actually for them. For example, if you're, like I mentioned, US universal health coverage is healthcare for all. So if you're designing platforms that will enable healthcare for all, it has to be inclusive. And being inclusive, there has to be contextual designs that will be able to guide everyone.
Yeah, thank you. Yeah, I still have a couple questions, but
Yeah,
I don't know
sure.
if Sanas would allow that. If others are not asking questions, then I think I will go ahead. But
Yeah, sure.
yeah,
Sure. Go ahead. Yeah.
okay, yeah. So another question I have is I think one of the motivation for the AI platform is to help like people who don't have the out of pocket, because like people have to go to the hospital and they pay out of their pocket to get the health care. And so I think at some point I got the impression that one of the motivation for AI health platform is to help people who don't have the out of pocket to access healthcare. But so I was wondering, will the AI platform solve this challenge? Because people will still have to buy data to access the AI platform. So how would that solve or curb the problem of needing money to be able to get the healthcare? And of course, the focus group is people who don't have much money. So I guess, yeah.
Yeah. So like I mentioned earlier, right? AI can do a lot of wonderful things, right? And like I said, of course, we understand that there are some people, because of their age demography, their location, and their financial status, they might not be able to have tools or equipment that will be able to, access this AI-enabled platforms that will be able to access healthcare or even buy health insurance. So that's why I'm saying that, even that AI can do this, it's also possible that we have to start looking inclusive as AI ethicists like us and regulatory governance individuals. We are moving and saying that there has to now have those people in mind. So if we are designing, how do we design platforms that will have those people in mind? So for example, I know in the advanced country, the 911 calls that people make, you don't have to have cash to make those calls. You make those calls and it goes in the case of emergency. Now call them the marginalized and underserved people. That's why we are pushing for contextual and tailor-made design processes and collaborative design processes. We want to get to the point of not having individuals building platforms and deploying for us to use. We will now want to become co-creators of those platforms, having everybody in the room deciding on how do this platform benefit us? How do my situation get into this platform? In that way, we are getting everybody together and designing an all-inclusive platform that will advance and achieve the tenets of universal health coverage, which is the ultimate goal.
Yeah, that's beautiful. Yeah, thank you for the great response. Yeah. Maybe last question. So I'm curious, do we have like some of these apps running in Nigeria as at now, like some of these AI platform where people can access healthcare? And I guess if they are, then some of the challenges you're talking about are some of the things you've seen over the period since it's been running. But if they are not, yeah, I mean, just maybe if you can comment on that a little bit.
Yeah, I love that question. So if you could see the second slide I showed, in how you have spring of AI startups that are moving up in Nigeria, also having foreign organizations or foreign companies, investing, angel investors investing in startup. And you could also say, when you say Nigeria is a country of 200 million people, the business individuals are also looking at, the business side of things, in terms of deploying or designing technology for these individuals. So already we have platform running. We have the Wella Health platform, we have the Calafia platform, we have the Mobi Health. So these platforms most of them are all on the startup, phases, 1 year, 2 years, trying to get their foot in the market, understanding how the market works. And that's why the research now and the conversations around data, AI ethics, for healthcare and regulations and governance are things we start saying, because I was with one of the CEOs, I said, why designing? How do you design? And most of them say, oh, we design based on the ideas that are gotten for the software, both by the structures that we get from our funders, and some say, oh, we just design. But we want to get to a phase where we can start having contextual frameworks, that will guide these designs. And when you have these frameworks, it will guide both software designers, owners of this platform, to understand that we are not just building platforms to deploy, but we are building an all-inclusive platform. Because, for example, you also see, that, in the plane, you have, seats, you have car parks for people who are who are physically disadvantaged and all that. That is building an inclusive society for them. And if we do that in real life, why can't we bring it, online now? Because now most of our lives are online. So we have to start building an inclusive platform that will be able to get everyone on board. Not only is a research, this is also a very strong human rights argument to make, to say, as we are now moving forward and building our lives online, it's very important that we start carrying along the underserved, the marginalized, and the disadvantaged, as we are doing, offline.
Thank you,
thank
Joseph.
you so much.
Thank you for your interest. Thank you so much for the interesting talk. I have a question, and regarding the ethical consideration you mentioned, just back into being inclusive and how people have access. Yes, you're right. Some digital application, making those digital application is something, even whether they are efficient for people is something else. But regarding those ethical consideration, I think not only for the Nigeria, your specific case, even for other countries, for the part that the data privacy or regulating framework is the same. I think this ethical deficiency is still in other platforms around the world. And what do you think? Do you think it should be somehow solved by the people's awareness, or somehow regulating framework, or somehow the transparency of stakeholders? What do you think is the most efficient one for these aspects, not only the inclusiveness and having access,
Oh, so thank you so much for that question. The most important aspect here is the regulation, right? So for example, if you're driving, there are regulations in driving. There's regulation in almost all aspects of our life. So why don't we have a sector-specific and contextual regulation that will guide the adoption of these technologies in healthcare, but not only in healthcare, in agriculture, in finance, in all those things. So, and that's why you could see the buzzword of responsible AI now, that you could see everywhere, AI governance, because people are beginning to say, if we don't put guidelines, if we don't start looking at regulations to race with these technologies, because these technologies are moving like wildfire. So government have to be proactive to start engaging within itself, engaging all actors, all stakeholders, both the captains of industry, policymakers, and the legislators, the users, to start looking at how do we put systems in place to start putting in regulations in place that we keep updating. Because if you have regulations, of course, after regulation comes advocacy. After advocacy, comes engagement, and all those things comes afterward. But we have to have a guiding principle that will really guide this adoption of these digital platforms. And these are all in the early stage of these platforms, especially in Africa, in Nigeria. And these are the most important times to start putting in these regulations in place. The best time is now, because if we don't do anything now, at the time will come that it will really be very, very, not very, very challenging, to really meet up with the demands of, putting those guidelines and frameworks in place.
Right. Thank you.
I think eventually most of these platforms become useless to the community, like you said, because they are not really built with the people's need in mind, like specific cases. They are more like general cases. And for every community, we have some specifics. And looking at the needs and the group of people, you tailor your app or whatever you build to meet the specific need. I think personally I've enjoyed your research because mostly like kind of addressing the need of the particular group instead of doing something general that people can access everywhere. But at the end of the day, it doesn't benefit the ordinary person in that local community. Yeah, thank you for
Thank you
such
so
a
much.
wonderful work.
Thank
Yeah.
you. Thank you.
Yes, sir.
We have something in chat. Lily says, thank you for the interesting talk. Thank you. And Joseph says, the next talk will be on 8th August. We'd be happy to see you all there. Thank you, Somto, for the interesting talk. It was really engaging. Is there any questions, or you are the voice of Nigeria? We really appreciate it. And thank you all for joining us. We look forward to see you on 8th of August. And thank you. Thank you, Somto. Thank you, Whitney. And
thank you, Santi. Thank you, Whitney.
Thank you so much, Somto. Thank you, everyone.
Thank you.
everyone.
Bye.
Let me stop recording.